Hello, nice to meet you.
Nice to meet you.
First off, I'd like to say thank you for your time and opportunity to speak with you about an important topic that I have been passionate about for some time now, and I'm hoping that together we can make a change.
Hello, it's very nice to meet you. And of course, I'd like to speak to individuals like yourself and give them an opportunity to make me aware of ongoing issues within healthcare to continue the progression of healthcare policies and safety today. So what would you like to discuss with me?
Today, I would like to speak with you about an important topic of nurse safety within the workplace environment, including the hospital setting, skilled nursing facilities, and rehab institutes, and more. My name is Adam Rivera, and I have been working as a stroke and cardiac nurse for about 3 years, and during my time working as a nurse, I have had a love and hate relationship with my career due to the workplace violence, working conditions that nurses witness each day, and I became a nurse because I have a passion for helping others, witnessing the progression of health in patients, and has been a long-time dream of mine. However, in the past 3 years, I have not only been verbally abused by the patients, but I have been physically hurt by the patients by getting kicked in the chest, kicked in the head, and have been verbally threatened my life and to be killed once I leave the hospital. Even though the hospital administration does not tolerate violence within the hospital setting, when patients act out and physically hurt the nurse and or other healthcare professionals, there are no consequences that the patient undergoes once they leave the hospital setting, and nurses are just expected to sweep these events under the table.
Wow, I am so sorry that you have undergone these working conditions. I knew that working as a nurse was mentally and physically tiring, but I was completely unaware that the ongoing issues of these nurses being physically harmed by patients with illnesses. Are you okay? Please continue.
Yes, thank you for your concern. I wanted to bring up this topic of nurse safety within any healthcare facility and emphasize the importance of it. I know throughout many years there have been many individuals who have advocated for nurses and other healthcare professionals about their safety and have discussed with many leadership representatives about their concerns. However, there still needs to be work done, in which there are no policies concerning consequences of a patient and or any individual that hurts a nurse during their time of work.
Yes, there have been many nurses advocates who have reached out to myself and peers about working conditions of nurses, but have never expressed the job safety in which patients are able to hurt the individuals who are helping them achieve health. Do these violent and harmful events occur often?
Personally, I have dealt with about 7 events of being physically abused by a patient and have thankfully only experienced minor injuries, including bruising and some pain. However, according to the American Nurses Association, in 2019 alone, 1 in 4 nurses have reported that they've been physically assaulted by a patient, and this does not include the unreported events that nurses undergo as well. These reported events are left unheard, in which they're expressed on a written form that's documented for the hospital and is discussed with the nurse later on, but there are no legal actions taken to the patient after they leave the hospital. This makes nurses feel that they are at risk to be freely hurt on a physical and verbal aspect by any individual that walks through the hospital doors seeking help.
I've never realized the perspectives and events that nurses deal with each shift in healthcare setting, and never considered the fact that these patients are receiving care and are able to physically and verbally abuse nurses freely. What do you suggest could help decrease these events from occurring?
My goal that I want to achieve is for nurses and myself is to have a sense of security and decrease the chances of being verbally and physically abused during our day of treating others. A policy that I would like to implement into our society and within the healthcare system includes creating consequences for those who are trying to physically and hurt any nurse or any healthcare professional, similar to police officer regulations. According to the California Law Group under Penal Code 241C, one cannot assault a police officer, in which it is illegal and considered a felony in many states in the U.S. I would like to suggest a policy and consequence that if a patient were to physically assault a nurse and has full capacity for decision making and is not confused, it would be considered a felony in a code of law and can result in up to a fine of up to $2,000 and up to a year in county jail. This would allow nurses to feel a sense of security for their safety, to want to continue working as nurses in a somewhat safer working environment. I need your help to make my idea a reality and attempt to increase the safety and security of a nurse in all healthcare environments.
This is actually an excellent idea that we can all emphasize in every type of healthcare setting to ensure that people who are treating and healing individuals are also safe during these circumstances. I would enjoy working together to help create the most safe working environment for all nurses in the state of California, and hopefully even expand on a national level to help these nurses around the country.
I am really excited to work with you and look forward to witnessing the results of decreasing the physical abuse events that occur with nurses and all healthcare professionals.
Likewise, I would like to further bring this up amongst fellow congressmen to further emphasize the importance of this topic on a wider scale.
Thank you for this opportunity and have a great day.
You as well. Have a good one. Until next time.
Until next time.